Ladies and gentlemen, Dr. Timothy McKnight.
Good evening, everybody. Hope you're enjoying this, the beautiful warm sunshine that we're having in Northeast Ohio, or if you're someplace else that you also have nice weather. Our classes are winding down quickly. We have 2 more weeks. So we're going to review tonight the highlights from this week's session on strength fitness and managing back pain. So we have a fire alarm here, and I'm not leaving unless I smell smoke or see fire. So I've got access to a window and to the stairs. So I'm just going to let this go. For those of you who are thinking about your, did you get that door? Maybe. For those of you who are thinking about the blood draws, we're going to be doing those on April 1st, Thursday morning. I think you know that, from 6 to 8 in the morning, unless you need to make other arrangements. So just contact Kelly if you have any difficulty with that. So again, strength fitness and back pain management. So I hope that you've been able to watch our presentations that were shared with you on Sunday morning. There's a lot of content, and I'm going to try to just highlight some of the key points. And it's always a challenge for me to know which slides to delete and which ones I need to show. So strength fitness can look like many things, just like cardiovascular fitness can look like many different things. So the point is we're putting the muscle under resistance, and we're putting a load on the muscle to stress it. And the goal is to make the muscle sore without injuring tendons or ligaments. So you have to do this gradually and consistently, and obviously the right technique, the right form is really crucial. So, I'm trying, many of you are not really that interested in strength fitness, and I think I understand why. But there is benefit, and there's a reason for you to strengthen your muscles. And if we just look at this one image where we talked about upper and lower cross syndrome, upper cross syndrome causes tightness in the shoulders and the neck, leads to headaches, can cause shoulder pain, and lower cross syndrome leads to chronic low back pain. So these are the muscles that you can see. We've talked about this before. Certain muscles that are tight that need to be stretched, and other muscles that are opposite those tend to be weak muscles that need to be strengthened. So if you have no other motivation for strength fitness than to eliminate neck pain, chronic tension headaches, and low back pain, that would be the reason to do this. So what is strength fitness? It's the ability of your muscles to move your body in a full range of motion, powerfully enough to stay as active as possible without hurting yourself. And getting older does not mean we have to lose muscle and get weaker. We know that our strength peak, our maximum capacity for strength happens in the late 20s, early 30s. But each decade after the age of 30, for most of us, there's a 15% decline in strength, not because we're aging, but because we're not using the muscles like we should use them. And with proper training, you can maintain your strength well into your 50s and develop strength at any age. At any age, you can get stronger. My father's been in the hospital for the last 5 days, and he's having difficulty getting out of bed now. So physical therapy is, he's going to have physical therapy that will strengthen his core and strengthen his gluteal muscles and his quadriceps to allow him to get out of bed on his own and to walk. And so he will see these fitness and strength gains by physical therapy. So at any age, we can move better if we strengthen the muscles. Unlike cardiovascular fitness, which results in a 1 to 3% loss of our ability to oxygenate our blood every year after the age of 30, strength gains can be achieved at any age. So all of us are capable of getting stronger than we are today with the right type of exercise. And what that means is you can move better, you have more exercise and strength capacity to move, to protect yourself from falls and injuries, and to keep your muscles and your joints in particular lined up properly so you don't have accelerated osteoporosis and osteoarthritis development. The name that we use to call muscle loss is called sarcopenia. So this is just Sarco means muscle, and penia means decline or less. And so this chart is telling us that by the age of 60, nearly 25% of those who are over the age of 60 are having a noticeable decline in their muscle mass. By the time you're 80, almost 60% of 80-year-olds are really feeling the effects of muscle loss. So they're more aged, they move slower, they have poor posture, more likely to fall, more difficulty taking a deep breath because the upper cross syndrome has rolled their shoulders in, their head down, and everything is starting to degenerate. So this is typical for most of us as we age, but it doesn't have to be something that we just accept and fall victim to. There's several different ways that we can lose muscle. And next week, we're going to talk about the steroid or sex hormones. We talked about mitochondrial dysfunction when we talk about how you increase mitochondria with cardiovascular fitness. We've talked about this week and the last several weeks, disuse and immobility and physical inactivity causes muscle loss. If you don't use it, you will lose it. And then we've talked a little bit about thyroid, and we'll talk about that more. We talked about insulin resistance. Not eating the right types of foods, and particularly good protein, can cause muscle loss. So there's many components in this equation as to why we lose muscle over time. But again, almost every one of these can be addressed so that we can maintain our muscle. And I just shared with you several articles and several statements from different geriatric journals about muscle mass and strength decline happening as much as a decline 15% every decade until the age of 80, when it starts to double. And this is not because of the number 80 or the birthday. This is because what most 80-year-olds don't do. Many of them are really bedbound by this time or very inactive, and they lose muscle. This study was just telling us that senior women at the average age of 72 had a comprehensive resistance and endurance training program, and they showed significant strength, significant improvement in all strength measures. So again, this is not only muscle mass, but muscle strength, aerobic capacity, weight loss, and loss of body fat. It doesn't matter what age you are, you can train at any age and get more fit, more trim, and more muscular. Another study showing that in elderly individuals, that with exercise, there's a improvement in gait velocity, or the speed that you walk, your stair climbing ability, and your dynamic balance, which is huge for those who hit their 80s and their 90s. The balance goes quickly if you don't have strength in your gluteal muscles, your quadricep muscles, your core muscles, and then develop or maintain balance by balance exercises. And then another study that just says that we can improve sleep quality by exercising and the arms and the legs. And these are nursing home residents. I love this slide because age really is just a number. We're the one that defines what we do with that age. So we've got Wendy Ida here at 64, didn't get into fitness till she was 43, and she really looks like she's in her 30s to me. Then we have Ernestine Shepard, an 81-year-old, who started working out at the age of 56. And if you follow her or Google her and look at some of her videos, what she's able to do with her strength and her flexibility and cardiovascular fitness and just her overall movement is absolutely incredible at the age of 81. Then there's Jeff Life, who I have met. I've read he signed the book that he wrote on this. He attends a lot of the hormone conferences that I go to. This was Jeff at age 57. He was on his boat. He had gone through an ugly divorce. He was gaining weight. He was drinking more alcohol than should have, and his life was unraveling quickly. He started hormone replacement therapy, and he started training correctly. And you see him at the age of 70 that he looks like he could be 35 with his build and the muscular physique. Again, this is possible if you're doing it gradually and correctly. And I realize many of you don't have a goal to look like any of these three people, but the point is you really do need to have good muscular tone, because it'll help your joint health and allow you to move without having a lot of aches and pains and putting yourself at risk for falls and injury. So there are benefits to strength fitness. We talked about these. I'm not going to read these again, but I'm trying to persuade you that this is a good investment in your time. And I can't overemphasize the importance of improving your balance. I'll share with you a couple ideas on balance in another slide. But this is something that puts many elderly people at risk, is when they start to have balance issues and they begin falling. So how do you develop strength fitness? Well, you have to fatigue the muscles with resistance training, and you want to do it at least once a week for the major muscle groups. And you're going to start off with 3 sets of an exercise that you do 12 to 15 repetitions of, and you fail somewhere in that 12 to 15 repetition, you can't do anymore. So maybe you can't move that weight anymore after the 12th repetition or the 13th or 14th. If you can't do 12 repetitions with a given weight, especially as a beginner, you're likely to strain something and hurt something. So you don't want to go real heavy. But if you can do 20 repetitions of a given weight, you probably need to stress the muscles more with a little bit heavier weight or heavier resistance. Eventually, you'll get to the point where you're doing your max repetitions will fail between 8 and 12 repetitions, and you'll do 3 to 5 sets as the muscles respond to the initial exercise bouts, which are 3 sets of 12 to 15 repetitions. It's critical to use the proper form and use the right body mechanics. You don't want to hold your breath. I explained this all earlier. It's really important, if you're going to do this, that you have somebody observe you that knows what they're doing, that knows how to make sure you're using the correct posture. And I find it really helpful if somebody can take a video of what you're doing, so you can see what your form looks like, and somebody can point out to you, this is not the correct posture. The muscle groups that we want to exercise are upper body, core muscles, and lower body. And I talked about this in detail on the Sunday release of this video. The upper body does pushing and pulling. The core muscles flex us forward like a sit-up, extend us backwards, and then twist us side to side. The lower body is really designed to help us stand up from a chair or a squatting position and then propel us forward as we're walking. Again, this is just some examples of how you might set up a program where you're exercising the upper body once a week, the core muscles once a week, and the lower body once a week. And in the workbook, we've given you beginner and intermediate level examples of exercises that you can do pretty easily from home with bands and with body weight. If you want to progress more, then you could spend time in a gym or get a personal trainer. I also gave you some exercise, sort of an outline for what a more advanced program would look like, with more repetitions and more sets with higher resistance. The principles of conditioning have to do with rest. You rest 1 to 2 minutes between sets. I personally like a 30 or a 60-minute rest period. Dr. Jacobowski and I lifted weights today. We did the push-pull, or the pushing exercises of the upper body today, and there was no rest period. When he was pushing the weight, as soon as he was done, I would get back on and do the same thing. So, and we did about probably 10 sets of different types of pushing exercises. So there's really little rest in between. You're breathing a little heavy, but it's not too bad. Again, you never want to hold your breath. You blow out when you're breathe out when you're exerting the most energy, and you have to use good posture or form. This, again, really, it's important that you get a personal trainer or someone that can guide you and direct you so that you're doing this properly, because you certainly don't want to use a bad posture, because you're likely to hurt yourself. We'll try to post some examples for you in the next week or two of some of the exercises that we do and some of the things that we've learned to help with posture to reduce risk of injury. Restricted blood flow therapy is a really phenomenal new technique, and Yoshiaki Sato of Japan was the one who developed this 50 years ago. It's called the Katsu technique, which in Japanese means additional pressure. And this first appeared in the United States about 9 years ago as a therapy for soldiers with limb-threatening injuries. Soldiers who had lost arterial flow, lost blood vessels, and lost muscles through explosions, stepping on a landmine or some other injury where they lost a portion of their arm or their leg, and they were trying to restore blood flow to maintain the viability of this limb, and also trying to find a way to help the muscle grow back so it could function to move the joints. So the concept here is that you partially restrict your arterial flow by 40 to 60% of your normal systolic pressure, which is the highest pressure required to open your blood vessels up. So you're not cutting the blood flow off entirely with these bands, you're restricting the flow. And if you're going to a physical therapy facility that does this, they do it very scientifically, and they're very careful about getting the exact restriction pressure on your limbs so that they get the benefit, the biggest bang for the buck. And this is a common technique used in professional sports now for rehabilitating athletes, and also at the college level. So it's a new technique that's been used for at least the last 5 years. They get great results from it. The idea is that you do a lot of repetitions of a very light weight. So you take your one max rep for a given weight. So if you can only bench press 100 pounds, then you would use a weight of about 40 or 50 pounds on a bench press with 30 repetitions, and you would repeat this several times as you wear these bands on your arms. And you're fatiguing the muscles as you do this. So the first set's easy. The next set gets a little bit harder, and the more sets you do, the harder it gets, because the blood flow is being restricted and the muscle fibers are starting to fatigue, and it's activating the fast twitch fibers to respond. And this is where the muscle growth appears. The idea is you're building up lactic acid really fast, and you're going to make your muscles sore, but the body responds to this stress with these interesting, phenomenal, great responses. So we've measured brain-derived neurotrophin factor. It increases when you do these techniques. So you only wear this band for about 30 minutes when you're in the gym doing these resistance training exercises. This BDNF is called brain fertilizer. It helps your cognitive function. We know that this restricted blood flow therapy increases muscle growth by blocking a chemical that slows down, or that blocks muscle growth. So, I'm sorry, it blocks the loss of muscle. So we're actually enhancing muscle growth. We're increasing muscle stem cells by 300%. So you have muscle cells in your muscles, and then you have stem cells in your muscles that are immature cells that haven't decided what type of cell they're going to be, whether they're going to be a tendon or a bone cell or a muscle cell. When you do this restricted therapy, you're increasing the conversion of these stem cells into muscles. And that's how you heal these injured muscles. That's how you get more muscle mass to accumulate in a muscle that's lost some of its mass. The other great benefit is vascular endothelial growth factor is enhanced. This is a growth factor that allows new blood vessels to form. And it doesn't form just in the limb that's injured. It enhances blood flow everywhere. So the body is capable of growing new capillaries and new blood flow to those areas that are not getting enough blood, that need more blood. So this can actually lower blood pressure, and it can be very good for the heart, for people who have heart disease. And then the other great response to restricted blood flow therapy is an increase in nitric oxide production, which dilates blood flow, enhances blood flow everywhere, to the heart, to the genitals, to the muscles. You have increased cardiovascular fitness and increased strength training fitness, because you have more blood flow to these exercising muscles and the arteries. So when you violate these strength training principles, you pay a price for it. And this was the story that I mentioned, that I was having these problems 20 years ago in my back and my left groin after I would drive, and then I couldn't feel anything on the left side of my left thigh. And the problem is with prolonged sitting, which I had done a lot of being in school as long as I was in school, is because my hip flexors were so tight from sitting, it rotated my pelvis we call this an anterior rotation, where it moves forward and it makes the buttocks kind of stick out a little bit. It causes you to have a little bit of a forward lean because of the way the pelvis rotates. The muscles of the gluteal area become weak because they're sitting all day and they're not being used. They're stretching and becoming weak. So it changes the posture. And this is one of the muscle that gets weak when you sit a long time because it stretches and it's not being used. And then these are the hip flexor muscles here. They attach on the spine and they come down to the thigh bone, the femur. And when they contract, it lifts the knee up. But if you sit a long time, you're shortening or tightening these muscles. And that's what happened to me. So it causes the pelvis to rotate anterior, makes the stomach stick out a little bit more, the buttocks stick out a little bit more. So you have tight hip flexors, weak gluteal muscles. It changes your posture. So can you imagine how this feels when you have perfect posture to stand for a long time versus someone who has this posture standing for a long time? This is very painful because the bones along the lumbar spine are almost crushed together because everything's so tight here in the low back, and it's weak in the gluteal muscles. So in my case, because of that tightness, I have arthritic pain right here in this joint where these two bones come together. I have a little genetic defect or congenital defect where the surface of these two bones where they join together had an abnormal angle, and it caused more arthritis and more pain. But then when the muscles that are attached there are being pulled really tight in the back because of the posture, it just pulls these two bones, this joint together tighter and tighter, causing more irritation, more erosion, and more chronic low back pain. And it's because of this lower cross syndrome. The hip flexors are tight. These muscles in the low back are too tight. The abdominal muscles are weak and the gluteal muscles are weak. So this is where you get the crisscross pattern. So to strengthen the gluteal muscles and to stretch the hip flexors, which is the best exercise I've found to eliminate or reduce my back pain, requires an exercise that stretches the hip flexors, and then an exercise that when you come up, it'll cause the gluteal muscles to fire and tighten, and it'll fatigue those gluteal muscles, and that will cause that pelvis to rotate back in the right direction to eliminate back pain. And every time I do lunges to the point of being sore, my back pain is improved as long as my gluteal muscles are sore. This Dr. Jakubowski kind of illustrating this technique, taking a nice long step forward. You don't necessarily have to do this with dumbbells, but you can see as he comes forward, his knee is still in line with his ankle. If you take a short step, then your knee goes ahead of your toe. That puts your knee at risk of being injured. So this is a great stretch for the hip flexor and a great exercise to strengthen the gluteal muscles. And again, you don't have to do this with weights. As long as you use the right technique and you go down far enough, your goal is to make your gluteal muscles sore. You want to obviously try to keep your body upright. If you lean forward as you do this, you won't stretch the hip flexor. You'll be able to clearly tell there's a difference when you lean forward versus standing erect with your body as you go down. So Dr. Jakubowski talked to us about back pain, and he talked about the central nervous system, the peripheral nervous system, and the autonomic nervous system. And the autonomic nervous system is actually part of the peripheral nervous system. The central nervous system is the spinal cord and the brain, and then everything outside the spinal cord and the brain is the peripheral nervous system. The autonomic nervous system that comes off the spine, its job is to control organs. It controls what happens in the stomach and the blood vessels and the liver and the intestines, the kidneys, the bladder. All these areas are automatically controlled for you, so you don't have to think about it. You don't have to think about dilating your eye when the natural light goes down. The peripheral nervous system automatically takes care of that, the autonomic nervous system. So this is automatic, but when you have issues with your back where these nerves come out, it can affect the autonomic nervous system. It's really interesting to me that Dr. Jakubowski can take infants who have problems with constipation or colic, and by gently massaging the low part of the back here where the autonomic nerves come to innervate the intestines, he can eliminate constipation problems, and he can help with colicky babies because they understand that these nerves in the lower spine can be stimulated to activate the organs to do what they're supposed to do. So spinal manipulation can be very helpful in sort of jump starting the autonomic nervous system in some cases. The other thing that we have to remember is muscles and ligaments. Not only do we have the spine, the vertebral column, but we have muscles and ligaments around it. And all these muscles have to be balanced. One muscle is balanced by another. They have to work properly, and the tendons can't be injured, or it will affect the way movement occurs around a joint. So when we look at the spinal column, it has this natural kind of an S-shaped curve. And so this would be the front of a person, and this is the back. So you can take your thumb and run your thumb down the middle of your back, and you can feel these, we call them posterior spinous processes. But the reason this is an S shape is this is a perfect, it's a perfect shape to help the spine absorb shock and to lessen the shock on the body as you're jumping off of a stool, or you're taking a big step down from a high step. It's able to absorb the shock and distribute this weight without injury. So it's really critical that we maintain the curvature of the spine. When you have a spinal fusion, because you've got a herniated disc, let's say we fuse 2 or 3 vertebrae because there's a problem there, and we put a rod in. Well, that will eliminate any more injury to this area, but the disc above and below that fusion is going to now receive abnormal pressures as you move and abnormal stresses. And over time, your risk of injuring those discs goes up because now it has to take on extra pressure that it wasn't having to manage before. So you have to be really careful when you start to have fusions of the lower spine or the cervical, the neck spine, because you're more likely to injure the discs above and below where it's been fused. This is just showing you the pressure when you have perfect upright posture. It's 12 pounds of pressure, which is the weight of the head going down on the neck and the spine. But as the head comes forward, as you sit at your desk all day and strain to see that computer, now there's 32 pounds of pressure being put down on your neck. And this is a lot of pressure for the neck muscles and the trapezius muscles of your shoulders. And this is why so many of us have shoulder pain and neck pain and chronic migraines, because we're sitting in this head forward posture. If we sit like this too long, over time, the bones of the neck will start to fuse, and we'll have a hump on our neck, and we'll be forward like this image here on the right with a lot more pressure. So this person is really going to have difficulty sitting for a long time because these muscles are going to be really tight, and it's going to tighten up the muscles or the vertebral column in the neck and cause them to fuse together. One way to tell if you've got an issue with this, where the head is too far forward, is to lay flat on your back. Now, I couldn't really illustrate this with images, but if you lay flat on the ground, on the floor, and your head is forward like this, and you relax your head is going to drop down, and the gaze of your eyes is going to be up and behind your head. And if you do that, then you know you've got this head forward posture because of this. We call this kyphosis. But if you can lay down and your head falls straight back naturally, and your eyes are fixed right above right above your eyes, then you have the correct posture in your neck. So hopefully you can see what I'm trying to illustrate with this, because this posture, the head's going to drop back because there's nothing to support it, and the eyes are going to go this direction. When we talk about the disc that cushions the spine, let me show you what the disc looks like if you look at it from the top. So this is the knobs on your back. When you rub your thumb down your back, you can feel those knobs, the posterior process of your vertebrae. And if you look at the disc that's cushioning between 2 vertebrae, you'll see this disc. It's got a jelly filling which acts as a cushion to absorb the shock of the weight of your body as you're doing different things. And then this is the spinal cord, and these are the nerve roots that come off the spinal cord. Over time, let me show you again what these discs look like if you could magnify them. they're like rings on a tree, and they're oriented at each layer, each ring is oriented in a different direction. So this gives the the cushion of the disc a great amount of strength. It can handle a lot of twisting, a lot of bending, a lot of abnormal pressure because it's so strong and it's got so many rings around it. But if you continually stress the back, if you're a roofer and all day you're bent over, or you're on an assembly line and all day you're twisting from side to side and then sometimes bent a little bit, what happens is you get micro tears in these layers around your disc. And as those tears start to progress, first of all, they can cause pain. Secondly, as the tear starts to progress, now this gel can start to migrate out because of the tears. And this will push on the nerve root, and then this will cause pain down your arm if this happens in your neck, or it'll cause pain down your leg if it happens in the lower part of your lumbar spine. So we're trying to avoid this. This is a disc bulge right here. This disc is pushing on the nerve root. This will give you that numb, tingling, burning pain down your leg. And this, as the gel extrudes out, will be a constant pain that won't go away with rest or with spinal manipulation or any other therapy. This is a surgical problem. We're trying to prevent any of these by using the correct posture and helping our back stay healthy. So Dr. Jakubowski talked about some of the chemistry and the mechanics of these injuries. And we know that when this starts to happen, you start to have this disc rupture and these rings start to become injured. It turns on these enzymes that are called matrix metalloproteinases. And this is the same enzyme system that causes the atherosclerotic plaque in your arteries to rupture. So we don't want to see this happen. This is sort of a bad response to chronic injury. And as these enzymes activate because of the injury, it breaks down the protein and allows this to dissolve the outer rings, and it causes more tears to occur. So we're trying to avoid that. And then inflammatory states like bad diet, a diet high in sugars and trans fats, or a condition like metabolic syndrome or diabetes, causes more of these matrix metalloproteinases, these enzymes, to become activated. So these conditions make you more likely to have back problems because your body's already inflamed. And then when you eat these foods, which is probably what got you these two conditions, you have more inflammation and more activation of these enzymes that cause further destruction of the disc. So this really does have a dietary connection. You can take anti-inflammatory supplements that may help. You can eat anti-inflammatory foods that may help as well. But these are the metabolic syndrome in particular puts you more at risk, partly because with metabolic syndrome, you tend to have a big gut, which makes you lean forward a little bit, puts a lot more pain, a lot more pressure on your lumbar spine, making you more vulnerable to injuries of the back. When you have chronic inflammation, when you've been bending over, for 20, 30 years repetitively, and your back starts to get stiff and sore, if you say to yourself, I'm going to stop exercising because my back is stiff and sore, then the body will stop moving, and the body will assume that since this joint isn't moving anymore, we don't need it to move. There must be a problem. So it will lay down more calcium, and then it'll basically lock this in so it can't bend anymore. And this is what you see as people get older and they get very stiff. This is to the point of no return. They're not going to get that flexibility back. But as you saw Coach Hartzell demonstrate and do his flexibility, he's kept these joints moving for the last 40 years. And this process, you may see somewhat of this on his x-ray, but it hasn't restricted his movement. And of course, moving the spine and enhances nutrients to flow inside and outside of this disc. And that's how the disc gets its nutrition. That's how it gets rid of the toxins that build up in the disc. It's basically a sponge with water in it. And think of it as a dirty sponge when you've got a lot of micro injury and tear in the disc. How do you heal that? Well, you have to move the back. You have to move it correctly. You can't be turning the garden over every day with a back like this and expect it to heal, because that puts too much stress on it. But if you do the right type of exercises, gentle exercises, and you see a chiropractor like Dr. Jakubowski, he can guide you into the things that will help your back get the nutrients without stressing the muscles and causing further injury. This is just showing you what happens where the nerves come out. A normal disc. This is a disc that is injured or swollen, and it's causing pressure to go on the nerve root. When it pushes on this nerve root, then this whole root is inflamed, and it causes pain to another area of the body. So I think this is a really important slide that I didn't talk about on the presentation Sunday. When people have back pain, you have to think outside the box. You have to think big picture. What causes back pain? Well, the first thing is arthritis in the joints. This is the joint that I have most of my arthritis in. The rest of it is not too bad. So the rest of my back, that is to say, is not too bad. So arthritic joints is one reason for pain. If I eat the wrong foods, if I lay around too much, the inflammation stirs up in here, my back hurts more. So I have to find the right activity, and I have to keep the inflammatory foods out of my diet to not be bothered by this arthritic joint. The next reason for back pain are these tears, these micro tears. So one time I was at the Pittsburgh airport and waiting on my luggage to come off the carousel. It was a big suitcase. It was about 49 pounds. And as it went around, I finally recognized it as my suitcase. I reached with my right arm, bending sideways and twisting exactly how Dr. Jakubowski told us not to do. And then I threw it across my body onto the floor. It was a reaction because I didn't want to wait for it to go around again. And I hurt my back. What I did is I tore some of these annular rings in my back. And it concerned me because I didn't know if I had herniated the disc. Within a week or so, the back was better. But those repetitive types of injuries will make me or any of us vulnerable to blow a disc out. So we've got to be really, really careful about these activities that sometimes we do, and we're just reacting to a situation and not thinking about how we can injure ourselves. So that's the second reason for back pain. The third reason for back pain is injury to muscles, tendons, or ligaments. These are micro tears. So often, if you have this lower cross syndrome and you stand for a long time, these muscles are going to tighten up. They'll get really tight, really stiff, and they'll cramp together, and they will cause pain. So this is the reason why when you have a herniated disc, you think, well, all I have to do is have this fixed. Just cut out the disc, the part of the disc that's pushing on the nerve root, and I'll be fine. I won't have any more pain. And the surgeon will tell you, I can fix this, but you only have a 50% chance of having your pain problem fixed. And that's because they can't fix the arthritis with surgery, and they can't fix the muscle, tendon, and ligament tears with surgery. So you have to understand that. But the good news is you're empowered. This problem is finding the right amount of movement with the right posture and eating the right diet. This type of injury or pain is a combination of strengthening and stretching your muscles, seeing a massage therapist, seeing a chiropractor. And these things can be reversed. You have to commit to it, but if you correct your posture and these other biomechanical defects, this can certainly be reversed. So that's the good news. This was he did the balance test on you, and he was just illustrating with this study that in a community of 300 people over the age of 60, 70% of those people had at least one fall. And the way you determine how you're doing with your balance is, as he had you do, is stand on one leg. If you're in these age groups, this is the duration of time you should be able to stand on one foot. This would be the average. Well, I'm 60 now. I don't want to just be able to stand 10 seconds on one foot and be like everybody else. I want to be 30 seconds or longer. I want to be able to challenge my balance. And so this is a really important addition that I made to this slide, because your balance is determined 10% by your vision. If you try to balance yourself in a room that's dark, it will be hard because your vision helps you judge distance and helps you realize where you are in space. So vision is important. If you have a problem with your inner ear, there is a balance mechanism in the inner ear. If that goes out, then you've lost 20% of your balance mechanism. Some of you had really bad vertigo where you think you're falling and you're not. That's because the ear is involved in this balance issue. But the most important area here is your feet. The bottom of your feet is where most of your balance organ comes from. So challenging yourself, challenging those pressure receptors on your feet is how you enhance your balance. So the exercise that he showed you, standing on one foot, if you can do that for the amount of time that you're supposed to, or the average person in your age group can do it, that's just a bare minimum. What you need to do is challenge that. Stand on one foot as you're brushing your teeth. Reach to open the drawer for your toothbrush. Reach for the faucet to turn it on. All of those movements are going to challenge your balance. And you're going to notice that your foot's going to wiggle like this as you're trying to maintain your balance. I'm standing on my left foot right now as I've gone through this slide. And as I'm moving my hands, my foot's wiggling. But it's teaching my foot this proprioception to respond to where my foot is. When you sprain your ankle and we put your foot in an air cast or a boot for 3 or 4 weeks, we've totally cut off the proprioceptive mechanism in your foot. We take that boot or that ankle support off, and your balance is going to be terrible in that foot. And then you're going to try to go back to a sport that you love, and you're going to be off balance and likely to injure yourself. So if you're a professional athlete, we're gonna challenge that balance with balance exercises. We're gonna have you stand on a Bosu ball, which is a half ball, and we're gonna toss a tennis ball to you and have you catch it in different positions. And your foot's gonna wiggle and your body's gonna shake, and that's how you're gonna get your balance back. This is something that all of you, I can't stress this enough, should be doing every day, so that when you're in your 80s and 90s, your balance is still good. There's no reason why you can't have good balance. And I see this so often. Once you fall and you're osteoporotic, your life expectancy for half the population is 6 months. That should never happen to any of you. This study was showing the recurrence of low back pain within a year is 60 to 80%. And my inserted question here is, why is that? What are we missing? Well, the answer is we're not identifying and correcting the root anatomical problems. Did the back pain recur because you continued to injure that disc? Did it recur because you've got a muscle problem in your back, or a tendon problem, or a ligament problem? Or did it recur because you haven't addressed the arthritis issue? So you have to get to the root cause of these problems and address those so that you can reverse or live with this back pain much more effectively. Chronic back pain, low back pain, ages the brain 10 to 20 times faster than normal. That's an amazing statistic here. That people that have this chronic back pain, they lose 5 to 11% of their gray matter every year, when you should only be losing 0.5% of this gray matter as a normal aging process. I'm not sure what the explanation for that is, but I know people that have this type of pain, they tend to not want to move, they tend to be inactive, and that's going to accelerate the development of more pain and more depression and more inactivity, more debilitation. And all those things combined, I think, cause a stress on the brain and make it age faster. He also showed this idea of how we can sometimes develop these injuries. So the tissue overload was what I did when I'd reached for that luggage on the carousel with the wrong posture, and then I stressed my back, and there was injury, and there was some scar tissue at formation. Those repeat injuries will cause more adhesions and scar tissue, making the muscles weaker and tighter, causing altered tissue function. Now I don't move my back the same way. Now it's stiffer. Now I have more tissue overload, and there's more injury. So how do we break this cycle? Well, when you get to this point, the first thing you've got to do is try to correct this altered tissue function. This means the tissues are tight, you're getting scar tissue, and it's going to change the movement of that joint. So you have to correct it. You can get massage therapy that can break up those adhesions. You can see a chiropractor like Dr. Jakubowski, who does active release therapy, a specific therapy that breaks up these adhesions, and you can restore the normal tissue function. But that's not enough. The next step is physical therapy or massage therapy that stretches and strengthens these weak or tight muscles. This is the complete rehabilitation model. So it's not just enough to give it time and say, oh, my back doesn't hurt anymore. It's to make sure that we restore the normal movement of the joint by correcting all the mechanical injuries to the tissue and then strengthening that joint so it doesn't happen again. When you have pain, it's trying to tell you there's a problem, and you don't want to just treat the pain with pain medicines and block that. You want to get to the root cause so you have a chance to heal it and reverse it and prevent it from coming back. This is another study that looked at symptomatic MRI imaging of a neck disc herniation, where these people had pain going down their arm because there was a neck injury. And there were two groups. One was either treated with nerve root injections, and the other one was treated with spinal manipulation therapy or chiropractic therapy. And the conclusion here is interesting. It said that those who were treated with spinal manipulation therapy were significantly more likely to report relevant improvement compared to those that just had the injections. So why is that? Well, the injections is a temporary relief. We're putting pain medicine at the site of injury, and we're letting it work, but it's going to wear off. So why is the spinal manipulation better? Because it goes back to that slide I just showed you. It addresses the adhesion problem. It addresses the tight muscles. It addresses all the other things that cause the pain. It's a much better treatment approach. You're just waiting on this to come back if you've had an injection. Then we have medication, acupuncture, and spinal manipulation, looking at all three modalities at managing chronic spinal pain. And he talked about this study. The conclusions is the key point, that the results consistently show evidence that with chronic spine pain, manipulation of the spine, if it's not contraindicated for some reason, is clearly a better approach than acupuncture or taking medication. And why is that? It's because we're addressing the root cause. We're starting to break up the scar tissue, and we're restoring normal motion around that joint so the body can heal. Can't overemphasize this enough. Please don't fall victim to the approach that says, I have pain, give me a shot, give me a pill, because you're never going to restore the function in that tissue and never going to give yourself a chance to heal it like it can heal. There's all different ways that things that we can do with our posture at work that put us at risk of these chronic problems. When we hold any of these postures for any extended period of time, you're likely to have neck pain, headaches, shoulder pain, chest pain. So we have to be really careful about what we do over and over again every day. And here's some other things that we do. One of the best pieces of advice that I can give you is when you're at vacuuming, a very simple activity, but this is often how people throw their back out. This is often how they herniate a disc. What they're doing two things wrong when they're vacuuming. When you're bending forward to vacuum, that's part of the posture we normally assume. But when you bend forward and then you lean, you twist sideways to reach a corner, that twisting motion puts an added stress on the back that makes you really vulnerable to popping that disc out and maybe extruding the gel in the disc to cause it to wrap around your nerve root and have pain down your leg. So the advice is always, when you're vacuuming, follow your feet. Whatever direction your toes are pointing is the way you bend. You don't bend and twist when you're vacuuming, because that can be extremely dangerous. He's illustrated the cat-camel stretch here as a great way to stretch the low back that becomes so tight. And we'll show you a video of this. We'll provide this for you to look at sometime on Facebook in the next week. But the idea is here is you arch your back like a cat. You put your chin in your chest. You're looking down at your belly button. And as you hold this arch, you start to sit back slowly. And as your buttocks comes to your heels, about halfway through this stretch, you'll feel the low part of your spine really stretch. And this is the part of the back that gets stiff and tired because it's tight when you stand for a long time with this lower cross syndrome. We always have to keep looking for explanations for why we hurt, why we have problems. You just can't accept that you're stuck a certain way. And if you have a provider that offers you nothing more than shots or pain medicine, they either don't understand biomechanics or they don't want to take the time to explain to you that there's more that you can do. The problem is most people don't want to pay the price to see the people and to do the exercises and stretches that are required to not live with this pain. Let me show you this image here of William Bell as an athlete at the age of 90, who is extremely, I think he's just a great motivation. Let me see if I can show this for you so you can see this, because I love watching this. Sorry, I always have difficulty finding these videos here. Let's see if I can find it in here. No, I'm not having so much luck here. I know it's in here somewhere. That's not where it's going to be. Well, I'll tell you what, I will share it with the Facebook group when we get there, because this is fun to watch him at the age of 90, setting the world record. So I will share it on the Facebook page if you'll watch that. So let me go to the last slide here. So this week we ask you to complete another 24-hour fast, and if you're really struggling with weight loss, then I would encourage you to consider doing this once a week, because intermittent fasting is how you're going to control your appetite so that you're not hungry. And then I'm asking you to do these strength training exercises from this point on. Spend 20 minutes once a week on your upper body, 20 minutes on your lower body, 20 minutes on your core, 3 separate days. Just start experimenting with this and start doing something. It doesn't have to look pretty. It doesn't have to be anything difficult or lengthy, but just start to use those muscles and stress them a little bit so they get a little bit stronger for you. Next week, we're going to talk about preventing the 2 most common diseases that we've talked about since the beginning. This should be a highlight, kind of a review. Then we'll talk about screening tests that you should be aware of and know about. We'll briefly talk about vaccinations. And then we're going to spend at least half the time on bioidentical hormone therapy, which is really, really key for many of us over the age of 50, because many of us, men and women both, have issues with our hormones that cause us to not function at the highest level we can. So I will really look forward to that. So I'm going to stop sharing the video now, and I'm going to turn to question and answers that you all may have. Did I just exit out?
See if Chris is going to put it on.
I'm not sure if I'm on anymore.
Yeah, you're still there.
Okay. Can you see me?
Yes.
Okay. Oh, there we go. Okay. So Debbie has a question about restrictive blood flow therapy. Yeah, probably not, Debbie. Those oh, I know what you're talking about. Yeah, those that wrap. Yeah, you probably could, but it might be a little bit difficult to do. I got my wraps on Amazon, and they're like, I think $20. There's a pair for the arm you put on the upper arm, right, just close to your armpit, and then on each arm, which I did today. And then there's a bigger strap that you can put on your leg, kind of around your groin, and you just Velcro those on there, or there's a clip for it. So that's pretty easy. I think I would prefer that than those wraps that he's got. I wrap it tight enough that I can still squeeze my little finger under the band, and I check my pulse to make sure I still have a pulse, because I don't want it to be that restrictive. You don't want it to hurt. You want it to be snug. And what it does is, again, it impairs blood flow and makes your muscles sore, because you get lactic acid buildup, and that really seems to help all those modifications and growth factors that are so good for you. I didn't see the last part of the question Hopefully I answered it though. So you use that band on your knees when putting it, stretching. Yeah, it's okay to do that. It's okay to put that band on your knees. You just don't want to do it, you're right, too tight. Yeah, so I think you're okay with that. Any other questions? Oh, it's another one. Best shoes to wear for exercise. Yeah, I just got a pair of basketball shoes, and I think the main thing you're looking for is something that's comfortable, something that's firm, and it gives you good support, but allows your feet to move. And I'm not sure there's a given brand because I think different brands of shoes fit each of us differently. So I would just make sure that you're pretty comfortable with it when you wear it on at the store. And if it's not comfortable the first time you wear it, then you should be able to return the shoe and get something that fits better. I'm willing to pay good money to find a shoe that fits me right, because it's a lot of pounding when you're doing basketball or running, and you just want to make sure that you're giving yourself the right cushion so that you don't injure the joints any more than you need to. Oh, yes. Thank you for that question about the bands. I just talked to Coach Hartzell tonight, probably just before we started. He had surgery, he did well, and we were playing phone tag. So he gave me the information. We'll share that with you tonight or tomorrow for how to contact him for the bands. He would love to speak with you, and I think he's got an email address that you can also reach. So we'll share that with you. Okay. Thank you all. I hope you guys have a great week, and we'll look forward to next week. Next week is going to be maybe a little bit longer than our average because I have a lot of information to share. It'll be at least 3 segments, and the last segment on hormone therapy may be a little bit longer than 30 minutes, but it's really important that you're aware of this and you understand what the benefits are and how it can help you. So I will look forward to seeing you then. I hope you have a great week. Stay healthy and stay active.